So thank you, Secretary McHugh, for those remarks. In addition to being a leader, I know he internalized operations research fully because he's now introduced a new problem. It's called the one moose, two moose problem. And if he had an operations researcher, either the Bush pilot was an operations researcher, either the Bush had the benefit of an operations researcher, he would have said that it would take this much more, it would cost this much more to either bring in a plane with a bigger engine to get that, or they would have landed farther out, maybe 100 yards to 200 yards. So it's an outstanding example to set the stage. So we're going to transition to this morning's panel discussion, and I'd like everybody up here, and they're here already. That's awesome. And I'd like to take a moment to introduce our moderator, Dr. Laura Albert. Laura is the Assistant Dean for Graduate Affairs in the College of Engineering and a Professor of Industrial and Systems Engineering at the University of Wisconsin-Madison. She serves with me and my colleague as on the Inform's Board of Directors and is also chair of this year's summit, this particular program. Laura's research interests are in the field of operations research and analytics with applications to homeland security, emergency response, and public sector problems. She has authored or co-authored more than 60 publications in archival journals and refereed proceedings, and her research has been awarded multiple honors, including the Inform's Impact Prize, multiple Best Paper Awards, an NSF Career Award, which is very prestigious, and a Department of the Army Young Investigator Award. Laura is also the author of a blog, which I highly recommend. It's called Punk Rock Operations Research. It's punkrockor.com. And at lunch, she'll tell you about all the punk rock bands that she really liked as well. So Laura, it's all yours.
Hi, thank you, Krishnan, for that nice introduction. And I want to also, before we begin, thank Secretary McHugh for his time and his experience and insights that he shared with us today. It is my pleasure to introduce today's panel that will discuss how operations research and analytics can save lives, save money, and solve problems. We have 5 experts today that will provide some case studies and some examples of things that they've worked on in the public sector and the private sector. And by the end of today's panel, you'll have a better understanding of how OR and analytics, through their case studies, provide potential solutions for any government problem and can also inform policy. So next, I want to introduce our panelists. So Dr. Bala Ganesh, on the end there, is the Vice President of Corporate Engineering at UPS, where he leads the Advanced Technology Group. UPS's Orion project, and that's on-road integrated optimization and navigation, uses expansive fleet telematics and advanced algorithms to gather and calculate countless amounts of data and provide UPS drivers with optimized routes with very few left turns. We'll hear more about that later. Next is Dr. Sheldon Jacobson. He's the founder professor of computer science at the University of Illinois at Urbana-Champaign. His research on multi-level aviation security, passenger screening at airports, was a precursor to risk-based security, providing the foundational concepts that informed the design and implementation of TSA PreCheck. Next is Dr. Karla Hoffman. She is a professor in the Systems Engineering and Operations Research Department at George Mason University. She did the recent work on the FCC two-sided auction that Secretary McHugh mentioned, which contributed more than $7 billion to federal deficit reduction. You all didn't sit in alphabetical order, so I have to check. Dr. Don Kleinmuntz is next. He's a respected analytics consultant and adjunct professor of IT, analytics, and operations at the University of Notre Dame School of Business. He is our healthcare expert who has collaborated with hospitals, academic medical centers, and multi-hospital healthcare settings on a range of business issues. And last but not least is Dr. David Shmoys, who's a professor of business management and leadership studies at Cornell University. He's also a research consultant to Lyft, and his research is focused on issues in mobility and the sharing economy, with particular attention to algorithmic tool development to support and bike sharing systems in areas such as New York City. So I think that's everyone. I'm going to sit down and join you, but as I'm sitting down, we've heard from the introduction that OR and analytics can be used to solve a wide range of problems. And so maybe you can all overview a couple of the things you have worked on to give the audience some ideas of things they want to dig into later with some questions. Sure, right. Go for it.
So, good morning, everybody. Thanks for having me here. I'm really looking forward to this conversation. The couple of projects that I'll mention, of course, the first one that, so if you think about UPS and what we do, right, at the highest level, we pick stuff up and we move things either by ground or air, and then we deliver the things, right, at the very highest level. So if you think about it, in all those three aspects of picking up, moving it through our network, either by air or ground, and then final mile, all of them have opportunities for optimization and analytics. So what Laura talked about, Orion, is for the final mile and pickup, but we also have optimization algorithms and prediction algorithms, both in what we call a line haul, which is our tractor trailer moves, and also in the airline network planning and optimization. So I can talk about all of, or any of them, if you want.
Back in 1996, I thought aviation security was an interesting research problem to consider using operations research and advanced analytics. The federal government budget, can anybody imagine what it was back in 1996? You could probably put it on a credit card by today's standards. It was in the hundreds of millions of dollars. We ended up getting a grant from the National Science Foundation starting September 1st, 2001, 10 days before September 11th. And it actually changed our direction. So back in 2004, we came up with this concept of treating people differently in terms of security. We created a video which you can find on YouTube. You can just Google it, and it was actually formally published in 2006. And that research eventually became the precursor to justify the existence of TSA PreCheck. How many of you have TSA PreCheck? How many of you could imagine flying without TSA PreCheck? Certainly life would be very, very different. So this is just one example of some of the things that we've done using operations research and advanced analytics. We've also looked in other areas of transportation, like looking at non-medical interventions for obesity in our society by considering how the transportation system impacts obesity. And once again, using operations research, data science, and analytics to inform those problems.
Well, hello, everybody. I'm Karla Hoffman. I'm not sure this is on. Can you hear me?
Yes.
Okay, good. So as you've heard today already, I work with the FCC related to the first two-sided auction. And everybody has highlighted the amount of money that went into the Treasury and how it impacted TV stations. And I'm happy to report that something that was not reported, which is that most TV stations remained on the air. Some are now channel sharing, but it wasn't as if you lost your public education station because of this auction. But the thing about this auction has really far more to do with the future. 3G is what allowed cell phones and all of the advancements that were related to the economy and cell phones. This auction relates to 5G, and there'll be another auction in November of this year, which is also a two-sided auction, so that very high-end frequency can also be used for things like drones, where the communication needs a lot of information, but who you're communicating with is very close by. I also am proud of this because there is now an Office of Economics and Analytics at the FCC, which is a result of the work that was done for the incentive auction. Just to end this, I have been involved in the policy world for my entire career because I live in the Washington area, but also because my first job was with the National Institute of Standards and Technology, and they did operations research and analytics analysis for any government agency that didn't have that kind of technology within their own organization. So it was work in transportation, it was work for the Treasury Department and the Internal Revenue Service, it was work for the Energy Department. All of those agencies now have analytics staffs. So it is sort of a sense of the change that has happened and the realization of just how much impact analytics can have on a government agency and on policy decisions.
Thanks, Karla. I'm Don Kleinmuntz. My involvement in healthcare really started in 1996. I was a faculty member at the University of Illinois, and I was one of the co-founders of a startup software company focused on financial analytics for hospitals and healthcare systems, primarily not-for-profit academic medical centers, large multi-hospital systems. We were focused originally on financial analysis, but just like the tagline you saw as you came in, saving lives and saving money, that turned out to be a central dilemma for hospitals and healthcare systems. And it turned out that we were able to provide these organizations with tools that allowed them to look across their full range of objectives. Were they saving lives? Were they improving the quality of lives? Were they saving money? Were they spending their resources appropriately? Were they doing the things they needed to do to have appropriate financial, physical, and information technology infrastructure in place? And allow them to look across and balance that. Now, that was very successful. We branched out and got involved in other aspects of how hospitals plan and budget. And I will tell you that probably the most interesting thing I saw was when the Affordable Care Act passed. Now, there's a political and legal process around that, and we don't know what the future looks like. I will tell you that whatever happens with the Affordable Care Act, the healthcare industry en masse transformed itself overnight when that law was passed. Not when that law became effective, but when that law was passed. And they started to focus with laser-like effectiveness on value-focused care. And what they meant by that was providing better care for less money. That actually created a huge analytics headache for them, because in order to do that, they have to actually figure out whether they're improving care. That's a non-trivial operation, or a non-trivial question, as well as how much it actually costs to provide care. And hospitals had to become much more effective at doing that. We were able to help them do that and to really get down to the individual patient. What does it cost to have encounters with that patient, to provide care across a whole continuum of providers when people have chronic conditions like diabetes, for instance, and really understand that it wasn't an either-or proposition. It's not either you save lives or you save money, but it's possible to do both. Okay, many organizations were able to do things like identify hospital-acquired infections that not only hurt people from a health perspective, but also cost the hospitals themselves a lot of money to take care of those people. So to the extent that they could prevent hospital-acquired conditions, it did both. It saved money and saved lives. And that's been sort of one of the most interesting and I think inspiring parts of the work I've been able to do in healthcare organizations.
So my name's David Shmoys, and I've been working recently on a range of activities in what's commonly called the sharing economy, and what may affect you living in DC most directly is capital bike share. Which, if you think about our urban mobility options, they've changed dramatically if you think about the past 10 years. That whether it be sustainable options like bike share or the scooters, which I'm sure there's a mix of opinions about how good they are, what they're doing for your lives as they've transformed DC. But even at a larger scale, the ride-sharing companies that have changed the way that we have options. So the common thing behind all of these is that there's a digital platform that drives it. That underneath that, there's common data that we have access to, now most commonly through our cell phones. But one thing that you'll hear a lot of us talk about or allude to in a number of ways is the role of models in the way in the work that we do. And I thought maybe it might be instructive is to think about a bike share system for just 1 minute of how does this mean that the system is working well, right? So there are a number of bikes that are contracted out there. There are a number of docks that are laid out throughout the system. But if I look at a snapshot, it's almost 11 o'clock on a weekday morning. How are things going? I mean, if you looked at the roads and you wanted to know how are the roads serving commuters at this moment in time, there were metrics out there. It's well understood. But with this new kind of mobility option, there isn't a real sense of whether the system is working. And one of the things that OR and analytics does is frame a way to capture what's important and how do we deliver what, are we actually then achieving those goals? So for example, the first agreements with cities focused purely on are bike stations out of bikes? Are they purely out of docks? And this only captures a little piece of whether the system is being used. Because if you think about it, the contract is there for a number of docks and bikes. If I tell you there are no bikes available everywhere, you're going to tell me the system is working badly? That means everybody's on their bike using it. So what's the right model? And how do you think about that? And once you frame a model like that, how do you then make the system designed to work well? And how do you then operationalize the system to have it deliver according to that metric?
Thank you, David. That's actually a great intro to my next question. So you all talked about this great impact that your work had, but when you got started, people didn't come to you with a problem and say, we need a reverse auction, or we need something, it's called TSA PreCheck, and it's gonna be amazing. They came to you with something else, and then you identified a way that operations research and analytics could really make a difference. How did you frame the problem? What are the things then, features that you noticed when you started working in these areas that you knew that operations research and analytics were really the right tool and could make a big difference?
I'm going to jump in.
Jump in.
Okay, so the story is exactly this. This is the kind of conversations that we have. I met with the executive director of Citi Bike. We started just working in New York before working with their systems more globally. They launched their beta users the Memorial Day weekend, just this time of year, 7 years ago now. And he said, well, we don't really have any analytics underneath what we're doing, and we have this goal that we're going to start every rush hour for every station that it's going to be half full, because we have 12,000 docks, we have 6,000 bikes. That seems like and I just literally almost fell off my chair. And I said to him, that's not what I really think is the right thing that's going to work for you. Why don't we keep talking over the next few weeks as you see the data working? And then we started working. And then, gradually we came to the work. They understood they had a problem early on. And little by little, the model evolved that sort of gave a pricing value for what, at any given moment in time, what the next bike at that station, in some sense, would have system-wide in terms of what its value would be. And it's this long conversation. Models, you start with a simple model, you see where it fails, you see where it works, and then you try to adapt and go along. So it's a very much a conversation to figure out what are the right aspects, what are the right elements. You think about bikes, one of the things that we, to this day, don't formalize, you'll be shocked to hear this, is the weather. We know that it has a huge impact, but we don't have the right models yet to do that.
For the FCC, the real question was, what is a broadband plan? How are we going to move forward? This is in 2010. And there was a committee that was to report to Congress about an overall plan for communications in the country. And it took lots and lots of conversations with the industry, with policymakers. And the question was, for example, so I'm going to ask this question to the audience: how many of you get your TV broadcasts over the air? And for those that are younger, I have to explain that is not satellite, that is not cable, that is not Wi-Fi, that is truly an antenna, which some people don't even know what it looks like, receiving TV coverage. So how many? In the country, the percentage was 10%. So it was perceived that there might be, that this very valuable spectrum might be able to be used for something else. The questions then were, how much could you repack TV stations to make that happen? And this was the first algorithms, the first studies that were done to just say, is this even possible? What do you think would happen now? And I will say that there were people in the industry who said it's too complicated. You simply can't do it. You will not be able to figure out how to repack TV stations, or it will take too long. Both of those things required models to prove that TV stations could be repacked, and that you could, after this auction, Congress legislated 3 years to get people to move to their new channels. That is happening. There were people in the industry who argued, said, took 10 years to go from analog to digital. It'll take at least 10 years for this. We're about to end phase 3, and it's happening ahead of our schedule. So if there's enough planning, if there's enough data, if there's the will to try to solve hard problems, I believe they can be solved.
We love how hard problems, that's for sure. It's not too complex. Sheldon, go ahead.
Pre-September 11th, with aviation security, the paradigm used was one size fits all. Everybody was screened at the same level, but the level of scrutiny was sufficiently low that that was in fact feasible. September 11th happened, the level of security screening took an enormous, a quantum leap up, yet the one size fits all was still being applied. People within the newly formed TSA knew that was untenable and basically could not be sustained. And that's when we started to look at the problem, saying, why don't we use information about the passengers incorporated into models that will enable us to, in fact, screen people differently, but in fact, do it at lower cost and increase the system security. So similar to what is pointed out by the other panelists, we're getting a win-win situation. Now, you couldn't look at it and see what to do. So we developed some models, analyzed them, and actually proved that that was possible, which of course became the proof of concept, so that when what we called multi-level passenger pre-screening, the TSA had a much sexier name called PreCheck. Also, for full disclosure, Laura Albert was my PhD student at the time, and she did her dissertation work on this. So in many ways, we have a whole family affair here.
I can talk about a couple of examples. One, I've talked about the typical what you think about UPS, so maybe I'll talk about something different, which people may not know. So one example I can talk about is as far as the pricing is concerned, right? So when you have a customer coming to us for a quote, one of the things that we had a what if. Hey, what if we could do this automatically without having to go through some kind of manual process? And so this was maybe a long time ago, maybe 5 or 6 years ago. So we used a combination of OR techniques and machine learning techniques to basically predict what's the most optimal, what the type of customer is going to be, and then prescribe what the most optimal pricing model needs to be for that customer. So that's one example of, apart from standard transportation OR problems, you can use the same approaches for something that really you didn't think about when you started off.
I'm a big believer in looking across industries, and that's something we do a lot of in the analytics space, is we look at best practices from space to space. So when I realized that a lot of what was causing healthcare C-level executives to tear their hair out were resource allocation problems, I was able to look across and see what was being done. And I was familiar with work that had been done, for instance, in how pharma companies and big oil and gas companies make decisions about how to allocate resources across multiple competing investments. I actually learned a lot from the way DoD did resource allocation, particularly given that they had a very complex set of mission objectives and needed to balance all of those in setting their objectives while paying attention to constraints. And that was actually a big inspiration for what we did in healthcare. So a lot of this is looking across different best practices, both in the public and the private sector, and trying to learn from what works and what doesn't work in very different spaces and pull it into the space you're working in. And that's been a big sort of lesson that I've learned.
I think that's a great insight. It's true. A lot of what we do is we borrow ideas from one sector and apply it to an idea in another sector because the actual principles are pretty similar in some cases.
I won't tell this story because it's not a success story, but it doesn't always work. So I tried to do some work with DHS around resource allocation that maybe wasn't as successful, but it was a good try. So.
Okay. Does anybody else want to chime in about borrowing ideas from other sectors or applying results from their work more broadly to benefit society?
Well, the concept of multi-level systems, we apply it in transportation, but in reality, it is actually applicable in many different ways. One of the big problems in security right now, which in fact causes more problems, and I'll ask the question, how many of you have been alarmed at an airport and had to go through secondary screening? Just about everybody. Well, think about if that didn't happen. And the concept is, how do you more appropriately target resources to match the needs of the passengers? But that actually applies across society. In our world of modeling, we call that conditioning. But the same principle could apply in other transportation systems. One of the things that we've advocated is a much more universal type of PreCheck system, which could be applied more broadly, and it would actually enhance the security of our entire society, not just in the transportation sector. So that's one area that we can use our ideas much more broadly and create a larger pond of influence while making it more effective, but also at lower cost for everybody.
Auctions have been around for a long time, but it was really a novel approach for the Federal Communication Commission to use auctions to allocate spectrum, and that started mid-1990s. I would argue that there are many government agencies who don't understand enough about the procurement process that may let the buyers or the sellers, depending upon who is truly what the application is, help decide in an economic way how to better, it's done all the time in the supply chain for industries. The question is, how do you apply that to the federal government when there is so much at stake in terms of budgets?
All right. Thank you. One of the things that I've heard from a couple of you, Don and Sheldon and Bala, is that this idea of quality along with cost reduction. And we've been hearing about resource allocation, and sometimes cost reduction and resource allocation gets a little bit of a bad rap. It's like you're skimping on something. But one of the things that I'm hearing from all of you is that you can actually do both and increase quality and increase maybe the delivery of healthcare. Does anybody have any additional thoughts on quality and maintaining a high quality in a system?
I can go. So one piece that you mentioned was Orion, right? So there's a huge cost aspect to it, right? But remember that we have, say, depending on the day and time of the year, we have somewhere between 60 and 100,000 drivers on the road every day, right? And each one of them doing about 200 stops approximately a day, out of which maybe, say, 40 to 50 of them are time dependent, so they have to be either done before 8:30 or 10:30. And then there are pickups that need to be completed between time slots. So now imagine the complexity of the problem, right? So you have each driver has 200 factorial they can do with time constraints, right? So you can see the complexity that builds up. So while the algorithm that we worked on and implemented had two effects on it. One is, of course, the reduction in time, reduction in miles. So we were talking about how last study we did maybe a couple of years ago, about 85 to 100 million miles we took off the road, right? So that's a significant amount of fuel burn, cost, emissions, et cetera, that we took off. But more importantly, it improved our on-time performance to the 99+% range from what it was previously, which was in the high 90s. But we got about a 4 to 5 percentage point bump just based on the algorithm that, because in the past, you had every human being trying to make their own choices of route changes that they needed to make, which now was much more optimized based on the algorithm that was running in the background. Now, since the first version, now we come down to we are up to the version 3. Now, it not only takes that, it takes into account the weather, the traffic, et cetera, and then makes adjustments as time goes on. So it not only does it optimize the beginning of the day, but it does it during the day, so that now if there is a risk of me missing a stop at a time window that I'm supposed to hit, it makes choices for me to make sure that I hit the quality first at the minimal cost, right? So it's always quality first. I got to hit the time window, but minimize the cost, keeping that as a constraint.
When we think of modeling, as David has talked about in his setting, there's often an objective or a goal, and there's also constraints. And that's something you deal with all the time. I don't think of cost saving as really being the objective. I think it's more in terms of value enhancement. And that's really what models do. How do you bring more value for the dollars that you're spending? And understand the trade-offs between the two. There's no one answer. So often when we think about optimization modeling in operations research, we want to come up with one answer. There's a spectrum of answers, and there's a trade-off in the value you receive based on what you're willing to accept in terms of the constraints. This is one of the values that we bring to the table in operations research, being able to understand those trade-offs.
So we have a few professors on the panel. We talked a lot about solving government problems, but there's a part of what we do that's very advanced, right? And there's funding for basic scientific research. Sheldon mentioned it, but I know he's not the only one that's contributed to that. Can you talk about the importance of scientific funding and basic scientific research and how that's played a role in moving the needle on government problems?
I'll try. I think that I'll take it from a different perspective, and that is that I believe important practical problems also drive new research. And new research allows the solution of important problems. And we need the ability to have the time to advance the science and then be able to apply it. But applying it also means that there will be new advances. So I at least don't want to separate the academic theoretical advances from the practical side of solving problems. And that's really what Informs does. It worries about the real world and real problems, but we really are mathematicians, engineers, people who want to advance science as well.
That's a great answer. I agree that they go hand in hand. One more question kind of broadly for the panel. So we haven't heard the words artificial intelligence mentioned yet, but I know artificial intelligence plays a role in what we do and what you all have done. Can you maybe discuss artificial intelligence and a little bit in terms of what you do or what you could do with some of the work that you've done?
You want me to go?
Yes.
Okay. So the at least my perspective, and this is my personal perspective, which is, there's a variety of tools we have in our toolbox that we use for the appropriate problem, right? So, depending on what tool is required for each problem set, that we pick from that, right? So, and I was just talking to Mary before this. In fact, I would say I am more, my background is more focused on machine learning and AI compared to OR problems, frankly. I've spent more time on that compared to this. But these are all just tools that we use depending on what problems we're trying to solve. So the way I think about it is, what is the problem you're trying to solve? Is it a prediction problem or is it a prescription problem, right? So if it's a prediction problem that says, given a certain set of data, what do you think is most likely to happen? I tend to kind of fall back on ML or time series tools. If it is, what is the most optimal or what should you be doing, I tend to kind of use OR-based tools. Now, there's gray areas in between, like some of the newer ones that right now we're working on, which are reinforcement learning neural networks, which kind of are a little bit gray in the middle of, I would say, brute force optimization versus some of the more elegant analytics-based optimization. So I don't know if that answers the question, but depending on the the problem we're trying to solve, we kind of pick the tools.
So, I mean, it's also there are a range of synergies that between how different scientific communities view problems that are going to come into play in a big way. So a piece of work that I've just been started thinking about, and to give a sense of the eclecticism of how our tools get brought to bear on a different range of problems, has to do with work that I've been talking to a group at the FDA about for building tools that take advantage of the fact that one area in which AI has advanced a lot is in things related to images. So, for example, in the area of radiology, there are all kinds of AI tools to help do some amount of preliminary screening and triage for diagnosis. Now, all of these tools get fed into the work stream of a human radiologist. And now we come to the typical OR problem. How do I sequence work so as to have the best outcomes? Now, there's all kinds of loaded things within that sentence. Best outcomes, what's best? Are we trying to measure risk? Are we trying to measure throughput? The range in which we model the essential issues is tantamount to being successful. But now there's this interplay between the kind of signals that the AI tools can give and the optimization tools. And there are going to be a whole range of different kinds of touch points where the new technologies from AI are only going to be half the problem. The other problem is going to be how do we integrate that within our regular work processes so as to really capture and deliver and make full use of their real potential.
David, that's really well said, and that example was actually something I was thinking about as well. My perspective is a little unusual. My dad was a faculty member at Carnegie Mellon and was an early pioneer on the use of AI, what we would now call AI, in diagnostic reasoning, a topic that is still going on and is still active and is still not being used. And so it's been 50 years. The technology is better than it's ever been. It's more capable. It's got more possibility, more potential. But the people and process side of it, I would argue, is what's holding things back. And the analytics community has a lot of knowledge on not just how to make better judgments, but also on how to implement those in real organizations with real people. And I think that's where we need to focus our attention next, so that it's not just a journal article that is sort of waiting for people to actually put it into practice in the clinic.
Yeah, I think I like both of these answers, and I'll try to just say I love the fact that this professional organization is called Informs, because that's really what we're trying to do, is inform. That we are, in a certain sense, staff, not line. Decisions have to be made, and they're complex. There are different answers based on what you think is most important, what are the constraints on the problem, who do you have to negotiate with, how is this whole thing going to work in practice? I think that's what operations research and analytics professionals are trained to do, to not give a single answer, but to give insight so that your decision-making process is more informed.
Operations research is about modeling for informed decision-making. AI is about modeling for informed decision-making. I believe that the circles have a strong intersection. AI has gotten a lot of attention because, just like Donna talked about with diagnostics, anyone in the medical community, you've read about these in the major popular press, because it's very tactical. But I think the next best big move forward for AI and operations research is at the more strategic level. It's not a matter of improving the existing system, it's creating the new system, what we call prospective analytics. That's where a great opportunity exists for us and the AI community. And moving forward is going to be critical to get the full benefit of these tools.
Well, in terms of strategic decision making, I have a question for David. First of all, I use bike sharing, and I'm amazed at how often there is a dock for me to park when I need to, and there's a bike available. And I know that's not by accident, because I also optimize systems, and you know that doesn't happen accidentally. But you've done bike sharing, you've worked with Lyft. What are the implications for smart cities and more strategic decisions involving the cities in which we live and work?
Sure. And there's a real evolution. And now, again, I should be very careful to say I'm speaking solely as myself, a private citizen, not as any affiliation with Lyft. That multimodal is going to be the catchphrase of the next coming 5 to 10 years as we think about how people move around cities. It's not going to be, I mean, many of you may use, I'll say Uber, to open, and you open your app, and there's Express Pool, which causes you to walk to a given spot and get a better price for a more trunk line kind of ride. But now imagine that we could also do that with scooters, or we could do this with bike share, or you could do it mixed with your regular public infrastructure. You could think about a tool that actually gives you suggestions for how to do your full ride, taking into account your own priorities, taking into account the weather. It's raining, we don't want to do this. So that there are a wide range of possibilities for how we're going to have a much more integrated system of transportation. And I would maintain that we probably still don't even know a significant mode that's going to be out there. I mean, both of the major ride sharings have tried various amounts of, things that are like buses but not like buses. And these games, and they are games because you have to sort of try in an experiment and playful kind of way, are going to drive how we think about what the options are going to be. And I see an amazing future in terms of that. And it's really the fact that we have the data in our hands and the ability to do sophisticated algorithms on them to integrate the complex system in ways that work much better than we ever imagined before. And with all of the underlying OR and analytics to do that, that really makes this possible.
Oh, very interesting. Sheldon.
Just want to follow up with David's point that we've done research to associate public transportation with obesity. And when you add in the ride sharing as well as the bike sharing, in essence, what you're doing is adding more caloric burning and expenditure in a fixed amount of time, which ultimately has, in our research, indicated it's a good precursor to lowering obesity rates. The other nice thing about public transportation and bike sharing is you can't eat a Big Mac when you're riding a bike. Although I have seen people try to do this. But time you can get someone from not eating in a day, 1,440 minutes, by golly, you could reduce obesity rates. And our research kind of suggests that.
Yeah, I mean, the only unfortunate counter trend to this is that one thing that will take over in a huge way, and I don't know how many of you have ever ridden an electric pedal assist bike, that this is going to be huge. I mean, in terms of an entity for a sharing economy principle, they're very expensive, but you don't need them that often. and they really change what's possible. I mean, I can keep up with my collegiate athlete daughter on a pedal assist bike while she's on her, generating on her own. And this really changes the way in people use the regular form of transportation. And this is what I'm saying. I'm sure I can't imagine what the right next steps and how these things might evolve in all these systems evolving.
Well, what about smart healthcare and next steps for healthcare? I'm always struck that good healthcare has like one part medicine, and we're all doctors here, but not medical doctors, and one part healthcare delivery. And it's amazing to me how much of a difference the healthcare operations makes. And Don, you talked about quality. Do you want to talk about maybe some next steps, especially with legislation or otherwise?
Well, I think one of the issues, there's really sort of two issues that are driving a lot of potential for innovation in healthcare. And I'm not sure that I'm an expert on either, but I think this is sort of casual observation, sort of confirms these are really important. One is data access and data sharing across the full continuum. So if I'm a patient seeking care at one institution versus another, can my data go with me to another doctor? Can it go across, to a physician's office? If I show up, get wheeled into the emergency room, can that doctor see my data from another organization? That's a huge problem and one that we haven't solved yet. And the other piece that is, I think, sexier and potentially game-changing, but isn't really there yet, is what I think is now being called telemedicine, which is remote access, particularly to specialty care. And that's particularly an important issue in rural settings and other places where you don't have access to the kind of resources we have in major urban medical centers. And so being able to connect people to the right provider, irrespective of where they happen to be living. And I think those both have huge potential to change the nature of healthcare in this society.
Yeah, Karla.
So you've heard some examples, and you note that they have a few things in common. A huge amount of data that needs to be processed. There needs to be the communication, and the communication is especially important as you think about rural versus urban. You can do telemedicine, but if you don't have the bandwidth, you can't do it, which means that it's another way of separating to advantage everybody in the country. There needs to be mechanisms that think not only about the big urban areas where the money really is there to do the development, but also in the rural areas and its implication to the entire country.
Sheldon?
Well, these comments really point to the fact that we're looking for, and we as kind of the big we, a one-size-fits-all solution, and the one-size-fits-all solution just doesn't exist. There are scenarios, and then people have to then negotiate across these scenarios what are acceptable. Now, there may not be anything that's acceptable to everybody, but nonetheless, there are scenarios. We're not trying to find that silver bullet because models, in fact, don't create those silver bullets. But my wife is a physician, and it's a paradigm shift when she has to see patients and do a treatment plan by telemedicine because the person isn't used to not having the doctor in front of them. In many ways, it becomes an education process. It's a human process. As skilled as we are technically, it still comes down to people interacting with people. And that's a critical feature of what we contribute to.
All right, so I've asked a few questions. You all may have some questions as well. We don't have a mic that's out there, so I'll repeat the question so everybody can hear. But does anybody want to kick us off with a question? Freeman?
Yes, my name's Freeman Marvin. I am an OR and analytics professional, and I appreciate you all being here. You did a great job of not being too geeky. I can be accused of that sometimes, although Sheldon and Bala kind of walk the edge there. But I was struck by Secretary McHugh's comments about the smart kids that he always asked the questions of, and then he went off, you know, and they were separate. A lot of Americans kind of feel that way. They're, on the one hand, they're grateful there's a lot of smart people optimizing everything, but they also feel a little threatened by it, that these smart people are running their lives. I wondered if you had any insights from the projects that you've worked on that could help build trust and confidence in many Americans that the kind of work that we do is taking into account some of the things that they're concerned about. Legal issues, such as property ownership of their data, discrimination, ethical issues surrounding our work, privacy, of course, and security. Ask anybody who had their credit report stolen from Equifax. What can you tell us about your insights as practitioners?
Well, that's a long question for me to have to repeat. I'm not going to repeat it word for word. But how have you worked with, I think, stakeholders to build trust so they'll actually want you to solve their problems and maybe implement your solutions or build policy around it so that other people will buy into it?
Let me try this one. I've had a limited experience with this. I think one sort of principle that I bring to these processes is you need wide participation. You need all of the stakeholders literally at the table giving input into the process. And that, if that includes representatives of the public or individuals who are motivated by particular concerns or interests, we have to figure out when we design our processes how to include their participation. I'm aware there's actually been some work done in Europe about designing decision-making processes that are specifically designed to incorporate public participation along with government and private sector stakeholders. And I think it's an interesting idea. You know, how that fits into sort of our style here in this country of making decisions is an interesting question, but you know, it would be one direction to start to explore in terms of bringing in more public participation into some of these decisions.
One area of research that our group is active in is algorithmic redistricting to combat gerrymandering. How many of you have heard of that problem? And it's a very, very heated discussion, and everybody's trying to establish what's fair and right, and our group ignores that approach. We simply try and create scenarios and explain from our algorithmic research what the implications are of the different objectives. We don't make the decision of what's fair because we don't know what's fair. In fact, we don't believe that there is any fair metric. And what the courts are doing right now, in fact, are fundamentally walking a line that can be attacked themselves. What we try and do is create scenarios and explain the implications of these decisions. So transparency, not fairness, is our objective. And when you do that, we're completely nonpartisan. Students in my group, some are very liberal, some are very conservative. We do take the politics out of redistricting. And when you can do that, it helps people be informed. This is how we try and achieve this.
So I don't know about the government. I can talk about what we did at UPS. So there's one big piece about involving the stakeholders in the problem-solving process. But I would say about the time we took, that's about 30% of our time. Actually solving the problem, creating scenarios of what. About 70% of the time we spent was on implementation, education, and change management. So typically the solving the problem, getting a good focus group of stakeholders involved, I think is the easiest part of the problem, at least from my perspective. The 70% of the effort and keeping to it and making sure it doesn't things don't degrade over time, making sure people understand the importance and understand exactly how this is going to work is what takes most of our time. So what we do, we break this into kind of three things. One is education. Second is an implementation rollout, which brings people along. We're typically using train the trainer kind of models. And then the last piece is performance management, ongoing management as we go along. So all those three have to come together. I'm talking only from a corporate private entity perspective. I'm not sure about the government. But all those three I would say is 70% of our effort, make sure that we try to monitor, educate people over time so that it takes about 3 to 4 years for it to become a habit. Then we no longer have to keep reminding people. So after about 3 to 4 years, as people become used to doing things a certain way, as the habit loops changes from the old habit loop to the new habit loop, then it becomes a little natural. Then you don't need to keep managing performance on a day-to-day basis, and you can start reducing the frequency over time.
So you're talking about buy-in with your employees.
That's correct.
Yes, very interesting. Karla.
I think the transparency is an important question. It's an important question for industry these days in terms of the data they're collecting and how they're using it. I think it's absolutely paramount for the government to be transparent and to have the education that is necessary for people to better understand the goals and whether or not the goals are being achieved. But it's not a simple problem. There's the push versus pull. There's a variety of things that change people's attitudes towards the process. But I think first you have to understand the process and the biases, and that's hard.
Any other questions from the audience?
Sheldon, you were talking about things that we've done for the airports and such. I mean, we've got bus routes, metro routes, things like that have signs up there that says, how long till the next bus? Why can't we have something like that for the lines? The lines themselves, for example, are independent, from the user's point of view, of how many stations there are on the other side. They can't see what's going on. So they all go to the short line, which only have 2 stations, and avoid the long line, which have 5 stations, and things along that line. The other part is I wondered if, with respect to your weight control program, you were talking with Metro about keeping X number of the escalators out of service. Well, in answer to your first point, the answer is yes. It would be very informative because in queuing theory, it's not simply how many people are waiting, it's how many people will serve the people who are waiting. And that level of transparency is not always provided. So the TSA can make some very simple changes that will help people make decisions when they are queuing. If you go to Reagan and you're going at 5 o'clock in the afternoon and 90% of the people are PreCheck, you would think they would have 3 PreCheck lines and 1 enhanced security line. Unfortunately, they have the reverse, and it actually takes less time to go through security, not through PreCheck, which makes no sense. Now, that's a simple change. Now, unfortunately, they don't listen to me. In respect to your second point, the Washington Post wrote an article about our research and tied in our relationship between public transportation and obesity reduction and said, well, if we have the escalators not moving. I did talk to the reporter about that. You obviously read the article, and we did not say that in our article, but I have no control over the press. I suspect none of you in this room do as well. So as a result of that, I would say it was a cute story, but not the basis of our modeling.
Yes, the question is, how can you use sharing economy tools for government applications?
So, I mean, the main question, given this morning's event, I was thinking about this question directly. There certainly are issues of ways in which material of limited resources could be shared across a broader range of things. Again, what are the elements that you need? You need sort of trust in availability of data so that you're willing to put that this is a resource that's going up on a common platform that then can be allocated in a pooled way. I mean, one of the things that we talk about big messages of our junior level courses, we talk about the role of pooling. And in some sense, the sharing economy is just the tying of pooling, the availability of data, and to some extent a pricing measure ability, and maybe a reservation component. And those are the elements, and it's really a question of trust, of being willing to make the data available so that limited resources can be, for whatever it could be shared across a broader range of things. I mean, I saw an item in China that they were using stations of pooled basketballs for that being the limited resource, so kids could go off and and young adults could go off and go play basketball. It's in some sense, what's the limited resource, and build in a mechanism that prevents that opens up the possibility of being able to make reservations and being able to claim the resource and be able to use it. Anything could really be used in that way. It's just a question of the digital platform that provides the opportunity.
Yeah, David, building on that, I've seen that some hospitals are starting to use like Uber and Lyft to help get people to doctor's appointments and to do interfacility transfers. And also ride-sharing boards are now being used to facilitate disaster evacuation.
The city of Boston, I believe, went over for not providing the ways in which MTA late-night disability available vehicles were taken out and replaced simply with Uber and Lyft. So because they found it was much more cost effective. Again, it's a limited resource, and just trying to use it in a better way.
Yep, and I live up north. We had a polar vortex this year, and Lyft in Chicago was giving free rides to bring people to warming stations. So people that, so also with very cold weather, sometimes we have power outages. And even if you have heat, it's not going to be working if you don't have power. And some local schools were powered up to keep people warm. It was nice. I think there was another question back there. Any other questions?
So suppose I'm a non-math major, and I really appreciate the application of operations research and understand how it is used for bike sharing at TSA. And I want to use optimization or operations research for my company. So how much of the math or modeling stuff I need to know before reaching out to someone, or if I at all need it, from where I should start?
So how to get started with using operations research and analytics with your company? Don?
If the person you're talking to requires you to know math before he can talk meaningfully with you, you're talking to the wrong person. That would be sort of my working advice, for getting started.
And most university programs in OR have components of their educational program that are looking for opportunities like yours, that are looking for interesting projects of companies that have a need, and are looking to match that with teams of students, so as to see if some doing good OR to do good can emerge from the partnership.
I would just agree with that, and also say there are lots of places you can reach out to. Obviously, universities is one. Also, if you have industrial colleagues that seem to be doing something interesting, reach out to them. I think the answer is networking will get you at least to the right people to talk to, and then those people should figure out what the right problem is.
Yeah, I want to piggyback on that. I've never talked to somebody who really knew advanced math, but I was lucky if they appreciated the value of it, so that's always helpful. I do a lot of work in emergency medical services, and it all started with a conversation. So a lot of our groundbreaking research and work we've done has started with a conversation with somebody who doesn't necessarily know how all the math works under the hood. But in my case, it started with a conversation with a local fire and EMS department, and one of their volunteer firefighters had taken a course in the department, and he didn't know how to solve the problem, but he knew to connect the fire chief with somebody from the department, which happened to be me. And I'm still working on that area, I think 12 years later. So, so we get something out of it too.
Another story is late in the 1990s, I came across a person who was at the Centers for Disease Control and Prevention who had a problem that didn't exist but was going to affect children vaccines, pediatric vaccines. They didn't know anything about what we did. So we talked to them. We spent a year learning about pediatric immunization and vaccines to the point that we eventually briefed different committees, the Advisory Committee on Immunization Practice, about our modeling efforts. It eventually got used by the drug manufacturers, was funded by NSF, ironically. So they gave us $500,000. It saved the country around $40 million per year because of the pricing models that we created. That's a pretty good, how many would like to make an investment of $500,000 and you get $40 million back? But it was our responsibility to learn the field, not their responsibility to learn ours.
All right, so I have another question. So building on that idea of everything starts with a conversation. The other thing that we heard, echoing Krishnan's comments earlier, is that data is important, but the point is that the data are just data. It's very helpful if somebody brings you some data, but we really want to turn that data into insight and then eventually help us make better decisions or do something differently. Can you talk about the data that you worked with? We've heard a couple of things. We've heard that if we're solving real complex problems, it's not like all of our data exists in one database. Sometimes we have to integrate and merge. There's privacy concerns. It's very siloed in transportation and other industries. So talk about the data. And Bala, I'm looking at you because one of the things I know about UPS is they invested, I think, more than $100 million in improving the data. It's like, why can't you just use like Google Maps to come up with the routes? But you actually invested a significant amount of money to improving the data quality.
Right, yeah. So I would say every project we start off with, we start off by defining what the data layer needs to be, or what is the data structure, and how should we think about after we've defined the problem and what we are trying to do. Once we're getting into the problem-solving process, we start off by we're looking at what the data framework or foundation need to be to get the appropriate variables that we need to solve the problem. So a lot of the time we spent on in the initial phases is to making sure we connect the right silos of data together, potentially from the outside or inside, and then getting it to a quality which we believe can give us the results that we need to solve the problem. So that's one piece. The second piece I'll say, which may sound a little counterintuitive, is that I also usually like to actually walk the floor at that time to try and understand what's happening and where the data is coming from, who's doing what. Just because it gives you a lot more insight into just numbers, which you see and you don't realize the nuances, what's going on. How are people making choices? There may be people doing manual overrides on the data that you just need to understand who's doing what in the process. So going back to the example that you talked about, it would be easy for us to, let's say, if we just said use Google Maps, for example, right? Then if I said this address, for example, 45 Independence Southwest, it would probably get me to that main road out there, right? Now, but from our perspective, it is important that we get to where the unload position is, and we know exactly where the driver needs to go from there. So we have billions and trillions of historical data, which we merge with external pieces of data to make those appropriate layers that will give us insight into. This is one piece of the puzzle. There's also other pieces of the puzzle. For example, when we're talking about our network moves with our airline, for example, you are now talking about combining external weather data along with traffic data, air traffic data, along with some of the load predictions that we do so that we can minimize our weight balance to improve the fuel optimization of the airplanes, which then aligns with making sure the data we get from our customers for the weight is concerned is appropriate. So we have prediction and correction algorithms that sit on top of what the insights we get to correct what we believe is the appropriate weight so that we can plan our load balancing appropriately. So I would say a lot of it is cleaning and creating the framework that makes it appropriate to solve the problem. Second is making sure you're adding appropriate insights by combining various sources of data, including yourselves and outside. And then the last piece, which I mentioned, is actually kind of putting yourself in the shoes of these people who are doing it and really understanding where that data is coming from.
I love that. You know, with better data, you can make better decisions. And we're not just like blindly looking at the data and the numbers. You're trying to really understand where it's coming from. Sheldon.
To give you an analogy, there are many countries around the world who are very rich in natural resources, but do not have the expertise to add the value to it, to transform it into great economic value, and they have woefully low GDPs and per capita income. United States takes pride in taking natural resources and transforming it using its people and its abilities to create extra value. Data is like a natural resource, but one has to transform it into information and insight. And that's where operations research and analytics really plays the role. It adds so much extra value that the natural resources, although they are necessary, are not sufficient to add the value.
Don?
I agree with what's been said, and sort of basic principles: more data is better than less data, good data is better than bad data. But it's also true there are really important problems where we don't have the data we want, or the data quality isn't there, or it's not the right data, it's not relevant to the issue. Don't be afraid to use judgment. And an analytical approach to combining expert judgments is a sound and better way than just, doing one of these and seeing which way the wind is blowing. And so there are tools and techniques for dealing with situations where you don't have the right data. And even in a world of massive amounts of data, we sometimes don't have the data that's relevant to the issues we're really trying to make choices about.
Great. I'll go back to the audience. Are there any questions?
Here's a question I've asked a number of colleagues, and I'd like to hear what this eminent panel has to say. Operations research and management science is a decision-making capability, tool set, or we say that we help get better decisions. But in recent work of people like Daniel Kahneman, Richard Thaler, has brought up the reality that people are not rational about making decisions, that we use quick thinking rather than careful thinking in making decisions. What can operations research and management science do to overcome that challenge about how people make decisions?
Sure. So just repeat the question. A lot of people, we know from our friends in psychology, make quick decisions. They respond on heuristics, they have biases, and we're talking about more advanced analytics and making very rational decisions. How do you make the rubber meet the road?
I would draw a distinction, and I have the advantage of having studied some of these descriptive decision processes. I would draw a distinction between describing the way people do make decisions and prescribing ways that we can make better decisions. So we are about better decision making and helping people to understand the role and the appropriate use of the tools to make better decisions. That doesn't mean that we don't need to understand that there are people out there we're interacting with or are making decisions the old-fashioned, irrational way. But it's an educational process to educate people about the value and the benefit of sounder, more rational decisions.
Yeah, and I think it's a learning process. If you think about using any mapping system, before you started using that, you got to places you needed to go to, and you did it based on what you knew. If you could get answers quick enough and developed a certain trust within some system, you're at least willing to look at the solutions provided, because it didn't take that much of your time, and now you have a slower approach, a more thoughtful approach, but from the user's perspective, a relatively quick approach, so that they can switch from one quick approach to another quick approach.
So I'll add a couple of things. This is a problem we wrestle with pretty often because of just the sheer number of people who are using some of our tools. First thing is I'll mention is if you read Daniel Kahneman and his recommendation for the most optimal way for humans to make choices, he says is look at a lot of the data, analyze it, then shut the book and make a intuitive decision, right? Your brain's gonna summarize it and give you the best solution, because you can't really sit and look at the data and make it. You just read through it, absorb it, close the book, and intuitively you'll come up with the best choice from a human being perspective. So, but there's a takeaway from there, which is I think a person making an intuitive decision who is more well-informed is likely to make a better decision than somebody who is just has no information at all. That's one thing that we keep in mind. The second is if there's a bunch of people with very little information, averaging them out gives you a better decision than just one person. So those two we take pretty seriously. And the third piece is we say is that even when we do optimization tools, et cetera, we always will, I guess, admit to the possibility that a human being can beat it. Okay? Because it's a model. We are making assumptions, we're making abstractions at different levels. So if we put those three together, right, so the thing is, one is, first of all, we recommend solutions, but we always say, if you can beat it, more power to you, and show us how you beat it, and we'll actually factor that into the algorithm. That's the first thing. In fact, that's a game we use with our drivers, which is, can you beat Orion, right? So that's the first one. The second is, especially when you're talking about more higher level kind of choices are concerned, like for example, the most optimal dispatching plan in the center, right? In those cases, we give a lot of data and then let people make those choices if there are, often there are complex problems that you cannot recommend decisions to, right? Because either you don't have the data or people are making things on the fly that is very difficult to model. So in those cases, we depend on giving a lot of data and letting them make those intuitive choices at the top. And then last but not least, especially when we're talking about network planning, we create optimization algorithms. We do a lot of people coming up with their own plans, and then we average it out and see who's doing better than who, right? So we use a combination of these three approaches to try and get around some of these problems that we're talking about.
Sheldon?
The key point that comes across is that when the output of our models are put forward, it's not the end of the decision making, it's actually the beginning of it. That's when the real discussion begins.
Well, I think that's a great way to end our discussion. We've had a great panel discussion. Bala, Sheldon, Karla, Don, and David, thank you. Let's all give them a round of applause.